Hello, ma'am. Good morning, ma'am. Is it audible, ma'am?
Yes, yes, it is audible. My voice is audible.
Yes, ma'am.
Okay. तू थोड़ी जो बात ना करे मैं काम करेंगे ओके भाई फालतू मत करे
Shall we start now?
Yes.
Namaste, namaste.
Namaste, sir. My voice is audible.
Madam, voice is audible. My voice is audible.
Yes, yes, yes.
Yes, yes.
My voice is audible.
Yes, madam. Yes, madam.
Okay.
Hello and welcome to all the participants. Very good morning to all of you. Today we are having a special guest. Hello. Today we are having a special guest, Dr. Sanghamitra Patnaik Madam, Professor and HOD, Department of Panchakarma, Shushrit Ayurvedic Medical College, Bangalore, Karnataka. On behalf of our department, we are welcoming you, Madam, for this national webinar on Panchakarma, Panchajanya 2020. Please welcome, Madam, to this session.
Thank you.
Yes, ma'am. Today, Madam, we want to know from you an ideal Ayurvedic healing process, a clinical aspect, whether Shodhana, Shamana, or both Shodhana and Shamana are aiding in this complete healing process. This we want to know from you, Madam. So I request all the participants, this is a very interesting topic. So please attend this webinar. And I would like to tell you that this webinar series is live in Zoom as well as YouTube. The recorded version is also available. The participants who are having any queries, please put it in the chat box. We are going to discuss at the later in the end of the session. So I request Dr. Radha to please introduce to our special guest today, Dr. Sanghamitra Patnaik, madam. Yes, madam. Thank you.
Thank you.
Namaste, ma'am. Good morning. Good morning to all. Myself, Dr. Radha from PANCHAKARMA PG first year from PANCHAKARMA department. It's my pleasure to introduce today's eminent speaker, Dr. Sanghamitra Patnaik, ma'am. Presently, ma'am working as professor and HOD in the Department of Panchakarma in Shushruta Ayurveda Medical College, Bangalore. Ma'am has a 27 years of teaching experience in both UG and PG. Ma'am is faculty member of Ayush System in Rajiv Gandhi University of Health Science, Bangalore, Karnataka. Ma'am has participated in several ROTP workshops and seminars and conferences. Ma'am presented many scientific papers in national and international conferences. We have honor to have you, ma'am. Thank you, ma'am. Today, ma'am is going to deal with an ideal Ayurvedic healing process, a clinical approach. Before we start the session, some instruction to the participants. Please mute your audio and video while joining the seminar. And if you have any queries, please put it in chat box. If there is any disturbance in the connection, wait patiently until the resume of network. Thank you, ma'am. I request you, ma'am, proceed the session.
Okay. Okay. Thank you very much. First of all, I am very much thankful to the management as well as the principal as well as all the staff, specifically the departmental Panchakarma departmental staffs, to give me the opportunity to share my view on this paradigm. So today my topic is Panchakarma, an ideal healing process. The topic is Panchakarma is an ideal healing process, a clinical approach. So let me share the screen first.
Hello, ma'am. Excuse me. I request you, ma'am, share the screen.
Yeah, I am sharing.
Hello, ma'am. Is it audible, ma'am?
Hello.
Hello, ma'am. Is it audible, ma'am?
Hello. It is visible.
Yes,
It is audible. Whether the screen is visible.
yes, ma'am.
Whether can you able to see the screen?
Yes, ma'am. Now you can continue, ma'am.
Yeah. Okay. Om Brahm. Okay. Start my topic today. So before starting the topic, I can you see now? Hello.
Hello, ma'am.
Hello, the organizers. Please. Hello.
Hello, ma'am.
Can you able to see the PPT now? Hello.
No.
Yes,
No,
can you
ma'am.
able to see the PPT now?
No, ma'am, not yet.
Hello.
Hello, ma'am.
I am sharing the screen now. Already I shared. Now can just you see. Now it is.
Multiple screens.
It can, but I am able to see all those things.
Hello, madam. Madam, we are seeing, we are able to see your slides, madam. You can continue, madam. No problem.
Hello. Hello, ma'am. Please do.
Very soon. Please stay. Right. We request all. No, there was some problem. Technical problem is there.
Hello, ma'am.
Hello. Hello. Can you able to see?
Ma'am. Yes, ma'am. Now it is visible, ma'am.
Please continue.
Please continue, ma'am.
Hello.
Hello, ma'am.
Video.
Okay. Can you able to hear me?
Yes, ma'am. Now it is visible, ma'am. You can continue, ma'am.
Yes. Can you able to see now?
Yes, ma'am.
Okay. Om Brahma Dakhya Rudrendra Bhuchandrarka Nilanalaha Yasaushadhi Grama Bhuta Sanghascha Pantute Rasayanam Devanam Amrutam Yatha Shudhe Bhautesajyam Midamastute. So far, give my thanks to all the management of the SVM Ayurvedic Medical Shabdas and all the members of the faculty members of this college as the Panchakarma department. So my topic is Panchakarma, an ideal healing process. It is not the only Sansamana and Sodhana, on the Panchakarma and ideal Ayurvedic healing process. Okay, so
I request to all the participants, please, some network problem is there, network connection is problem is there. Please wait patiently some more time.
hello.
Hello, hello, ma'am.
Yes. Topic is Panchakarma, an an ideal healing process. So basic concepts of Chikitsa, what I want to discuss today, multifaceted action of Panchakarma. Panchakarma activate rejuvenation, different stage of life. My topic is specifically different stage of life, and in different stage of, it is audible, ma? Hello, whether it is audible?
Yes, ma'am. Now it is audible.
Madam, continue, madam.
Okay. So, yes. So my today's basic main key points, what I want to discuss today, basic concepts of Chikitsa, Panchakarma and Shodhana, multifaceted action of Panchakarma, Panchakarma activate rejuvenation, different stage of life, and disease occurs in different stage of due to physiological and pathological changes, and specific commonly practiced Panchakarma treatment for diseases in different stage of human life, and few guidelines based on my experience. So means I want to explain basic concepts of Chikitsa, and specifically in the Siryate Anena iti Sariram, Chiyate Annadivi iti Kayam, Bardhane. Means entire human body, Chiyate Annadivi iti Kaya, which is get nourished by the food. Then next is Siryate Anena iti Sariram. Our body always get destructions, and Vardhane, it is growth occurs time to time. So my topic is the destruction is definitely, it is the natural way, and in the natural process, what are the diseases occurs in each state of life, in each stage of life, and during that for that diseases, what are the Panchakarma therapy we are giving in day-to-day practice, and I want to share my experience about these things and to enhance the strength and confidence of this future generation of the Panchakarma by sharing my practical experience as well as teaching experience. Next. So this is about the Ayurveda Avatarana. Why I am discussing the Ayurveda Avatarana? Because I am not discussing because this is one so we should have the faith first on Ayurveda, then we have to check, then only we can get this successful result. And whatever you mean, faith is important. So that everybody know. So it is one eternal science. We should have the faith. Then we can discuss my next topic. This is not water. This is nothing but the Yat Pinde Tat Brahmande. That concept. You understand this concept. Yes. Now it is audible.
Yes, ma'am.
Slides.
Yes,
So
ma'am.
next is
Slides are not.
Ma'am, slides are not. Now it is same, ma'am.
then
Yes,
basic.
ma'am. Yes, ma'am. It's visible, ma'am. Now.
Basic. Before starting my topic, I want to my first point is basic concept of Chikitsa. Everybody know because the Panchakarma students and the teacher faculties definitely you know Doshaha Kinaha Brunghaitabhya, Kupitaha Prasamaitabhya, Brudhva Niraitabhya, Samaha Paripalya iti Siddhanta. This is the reference from Susuta Chikitsa 33 chapter and 3rd sloka. So what is the meaning? Everybody know when our main aim is to maintain the equilibrium. where the dosha khina is there, we have to enhance it. Vruddhi is there, reduce it. Kupita, prasama, sansamana also to administer this sansodhana chikitsa. Then next is here only I explain first about understand where we have to administer the panchakarma chikitsa. Not only I want panchakarma chikitsa, but don't give first we should be administered it. So here means that is everybody know decreasing nourishment chikitsa. Then upita is of two types. Upita where prasamana chikitsa we should give. It is of two types, that is chaya purvaka and achaya purvaka. In chaya purvaka sansodhana purvaka samsamana. Please understand this concept. Sansodhana purvaka samsamana. For example, we are giving in some diseases we are giving the kativasti. That is one kind of sansamana also and sansodhana also. So that is the upita is of two types. First you understand chaya purvaka and achaya purvaka. In chaya purvaka means gradual, when the gradual aggravations of the dosha occurs, there which type of sansamana, that is sansodhana purvaka sansamana we have to give, and in case of achaya purvaka sansamana aushadhi we have to give. Then vruddhi is again it is of two types. One is chaya purvaka prakopa and chaya purvaka which is samhati rupa. Another is prakopa. Prakopa is bilayana rupa. So vruddhi is of again two types, chaya and prakopa. Chaya is samhati rupa, means stagnated, it is not liquefied. So that is called, in that conditions also we have to give, but mrudu shodhana we have to administer. Next, prakopa is bilayana rupa prakopa, where it is the exact signs for the exact site for the samsodhana, that is panchakarma. Then I will explain what is panchashodhana and panchakarma, because so many confusion occurs, and the new physicians they are getting confused for the administrations of the panchakarma. So samaha paripalya, there we have to administer the maintenance of the swastha bruta, we have to follow the swastha bruta. So now in this slide I want to explain khinaha brungaitavya, upita it is chaya purvaka and achaya purvaka. Chaya purvaka sansodhana purvaka sansamana aushadhi, and achaya purvaka samsamana, direct samsamana we have to give. And vruddhi is of two types, chaya and prakopa. In chaya prakopa, which is samhati rupa, we can give the mrudu sansodhana. In prakopa, which is exactly bilayana rupa, that is the exact signs of the exact site for the sansodhana therapy. Then samaha paripalya. Next, again I want to explain these basic things before sharing my practical experience. Sodhayati iti sansodhana, it is of two types, bahya and abhyantara. So bahya sodhana is shastra, khyara, lepa, abhyanga, etc. That everything will go under this bahya sodhana. Abhyantara sodhana is Svmamc virechana, asthapana, raktamokshana, this and nasya. This is the, then I want to explain you what is panchashodhana and what is shodha, what is the panchakarma. So panchakarma and panchashodhana, there is not so much of difference, so don't get, it is not a big issue. It is only the opinion of two different authors. According to Panchakarma, where he mentioned Nashya, Vamana Virechana, Asthavanavasti, Anuvasanavasti and Nasya, whereas the Susruta, he meant Susruta and Bhagavata mentioned Vamana Virechana Basti, Nasya and Raktamokshana. So, hello. Next is multifaceted effect of Panchakarma. So, in the previous slide, everybody you know, it is a very clear thing that it is the opinion of the different authors only. Panchashodhana is Raktamokshana according to the and Raktamokshana and Nasya according to the Susruta and Bhagavad. According to Charaka, he and Sarangadhara Bhava Prakas, they also use the particular term Panchakarma. Of Panchakarma. Everybody you know that is the preventive aspect, curative aspect, and rehabilitative aspect. This is nowadays done, we are giving, it is highly effective now, and it, due to this only we are the Ayurveda, people are preferring Ayurveda. So preventive aspect as well as rehabilitative aspect, it is very much important nowadays. Preventive nowadays, in the corona time also, Ayurveda, the people are giving emphasis on the Ayurveda for the preventive aspect. So that is dinacharya and rutucharya. Starting from the day, starting from our day, we are administering the shodhana. For example, you can take jiva nillekana, danta prakshalana, all those things comes under the shodhana. So, and rutu shodhana. Rutu shodhana concepts, every madhava pratama masi, everybody know these things. In the, this is the 3 seasons, particularly in the sadharana rutu, we should administer the shodhana. In the vasanta, vamana should be given. In the sharat rutu, virechana should be given, and in the varsha rutu, the vasti should be given. So in the dinacharya, starting so many stepwise things are there, that is comes under the preventive aspects of the panchakarma. Then we have to go for the promotive aspect of the panchakarma. So what is promotive aspect? Before the rasayana and vajikarana therapy, these are more important factor of the of our more important branch of our science for the health promotion. Before administration of the rasayana and vajikarana, it is necessary to administer. If we administer the shodhana and we go for the rasayana and vajikarana, then definitely we will get excellent result in the day-to-day practice also. We are observing that. Then before the administration of the Sanghamitra therapy also, if we administer mrutu shodhana and we administer the Sanghamitra therapy, then the action will be very good. So for the health promotion, before administration of rasayana vajikarana, the Ayurvedic will helpful. Then coming for the curative aspect of the panchakarma. Curative aspect, dosaha kadachit kupyante jita langana pachane. Already I am explaining, excrete the dosas from the root. When, for example, in our day-to-day practice, we cannot say that by administration of the what it is told that dosaha kadachit kupyante jita langana pachane jita sansodhanitu. Not a sankunarudbhava, doshanancha drumanancha, so many are the malapaham rogaharam balavarna prasadanam. So, but nowadays, what we are observing in our day-to-day practice, it is not that it is completely get excreted, but the duration of the reoccurrence is less if we administer the shodhana therapy. That is our observation nowadays. So, evam vishuddha kostasya kayagni abhivardhate. So, it will enhance kayagni abhivartate vyadhayasya pasamyati, means enhances the digestive capacity, which is the main factor of the diseases. Then coming for the rehabilitative, it is nowadays it is very effective treatment we are giving for the rehabilitations, because in case of the pakshagata, in case of the avabahuka, in case of the so many diseases, mansa do their normal routine duty. So during that time, we are providing some of the treatment by which they can able to perform their normal routine duty, and even if they are not, they become just like their previous state, but the conditions are improving. So we are providing the better life for the human being by administration of the panchakarma. So we should understand what is the preventive measures, promotive measures, curative measures, and rehabilitative measures of the panchakarma firstly. Then coming to the panchakarma activate rejuvenation. How, starting from the purva karma, pradhana karma, and paschat karma, it rejuvenates the body. It enhances the OJOVRUDHI. How? Because purva karma cause the dosha vruddhikarana. Everybody know we are administering dipana, pachana, snehana, shvedana for the liquefaction of the dosha, and by that what it cause? It cause the dhattvagni vruddhi, dosha vilayana, dosha gati from shakha to koshta. In the dhatu level, what it do? It causes the dhattvagni vruddhi, by which it liquefies the doshas. In the pradhana karma, then the action of pradhana karma started. What it causes? It causes dosa anusara, dosa visargana, the expulsions of the dosha. By this, what happens? Srota Suddhi happens and Dhatu Suddhi happens. It acts on the tissue level, minute tissue levels, nuclear level, the electron proton level. All these minute channels of the body get excreted by the toxins get removed from that part, and it causes the Dhatu Suddhi and Srota Suddhi. Then by the Paschat Karma, we are giving what? We are giving Peyadi Sansarjana Krama, Tarpanadi Sansarjana Krama, Rasadi Sansarjana Krama, for the purpose of what? For the purpose of Kayagni Dipti, Agni Dipti, and it provides the strength which loses during this entire process. So it activates gradually the metabolism. So in this way, by administration of Purva Karma, by administration of the Pradhana Karma, by administration of the Paschat Karma, it activates the Dhatu and quality of the Oja, quality of life, as well as it causes the OJOVRUDHI. Then OJOVRUDHI, by administration of OJOVRUDHI, what it causes? It causes activate immune system, which is the essential factor. Which is the essential factor in the present scenario. जैसे कि COVID आ गया है, so during that time, what we can do? We can only improve our immunity. I am not telling that it has no capacity to cure. It has the capacity to cure, but immune system, its main speciality is it activates the immune systems. So activate immune system by providing the proper nutrition. How? Because due to the Srota Suddhi, provide the proper nutrition to the tissue, and Srota Suddhi activates obviously functions of the cytotoxic T cells and helper T cells. What is this? These are the responsible for the immune systems, because all the cells, it activates all the actions of the Rasa, Rakta, Mansa, Meda, Asti, Maja, Sukra. So activate longevity and health. So it providing and mental importance also. It not only it causes the activations of the bodily factors, it also activates the mental factors, and it activates antioxidant action on the limbic system. Obviously, the mental factor means it activates the limbic system. Delayed. So due to all those things, due to Srota Suddhi, due to longevity actions, due to the activations of all the cells, so it causes delayed degeneration and activate rejuvenation. So in this level, up to this level, I explain what our Panchakarma is doing, and what is the difference between there is not such a big difference between Panchashodhana and Panchakarma. It is only the difference of opinion, and only Rakta Mokhyana is added by the Maharshi Susruta and Bhagavata, which Charaka never accepted. Then come for the next. So till late I explain what I want to say here, that in the day-to-day practice also we are observing how the immune system get activated after administering the Vamana, Virechana, Basti, etc. Then come for the different. I want to explain you that the next point, different stages of the age. Here, why I want to explain, because how the Panchakarma act as a healing process. Again, very nicely explained our Sobli Charaka Susutta and Harita, which is because Kashyap also here, he Purva neonatal conditions also in the considerations of the age, but I am not taking, because for the purpose of treatment I am taking what conditions we are dealing, that I am taking. So Balyabastha, that is according to Charaka, it is 30 years up to 16 years Aparipakwa Dhatu Avastha, and I will explain same things. And during these times, what are the treatment we are providing? So up to 16 years, that is Aparipakwa Dhatu Avastha, and 16 to 30 years is Vivardhamana Dhatu. So next is, according to Harita, it is 1 to 16 year age Balyabastha. Next, Yuvavastha. Harita accept Yuvavastha. He had only considered Yuvavastha 16 to 25 years. Others, they never considered the Yuvavastha. Only the Harita mentioned 16 to 25 years. He considered it as the Vardhamana-avastha. So what are the physiological changes during that time? I will explain later. Then Madhyavastha is 30 to 60 years according to Charaka, which is the Sampurnata. They considered it as the Sampurnata. Mahasi Charaka explained it as the Sampurnata. According to Susruta, Madhyavastha is 60 to 70 years. Among those, 16 to 20 years is Bruddhi Avastha, 21 to 30 years is Yauvana Avastha, and 31 to 40 years is Sampurnata, and 41 to 70 is Hani. Means after the fourth decade of Harita, 25 to 70 years he considered as the Madhyama Avastha. Out of those, up to 50 he considered as the Uttama Taruna Avastha. Then Vruddhavastha, according to Charaka, it is 60 to 100 or more who can live, and it is the stage of Hiyamana Avastha. And according to Susruta, 70 years what it is the Vruddhavastha. Then according to Harry, 70 to 80 years and onwards, it is Hinabala Avastha. So this is why I am explaining. This is Balyabastha, Madhyavastha, and Vruddhavastha. What are the physiological and pathological changes occurs? Due to that, what are type of the diseases we are facing, and what are the medicines, what are the panchakarma we are giving, which can shows the healing effect. Next comes. These are the stages of human life. You can see from the fertilized egg, fetus, baby, then the adolescence age, different stage of adolescence, then Madhyavastha, then next stage, the old age, and last one is Panchatva Prakti, that is there. Next stage, 2 years. What type of changes occurs? So up to 10 years he mentioned it is Aparipakwa Dhatu Avastha. But according to modern concept, what they mentioned back to 2 years and little development of the motor skills. And they see us pre-optional, that is symbolic thinking. Their thinking gets speaking a language. Then, and imagination years, logic, they try to apply the logic, and that is things abstractly, different types of thinking. Next stage. So in modern concept, what is our mentioned in our concept?
Excuse me, ma'am.
Gradual development. What things occurs in the Balyabastha up to 12 years. Yes. Hello.
Hello, ma'am. Ma'am, your voice is not. Hello, ma'am. Ma'am, your voice is not clear, ma'am.
Hello. Hello.
Hello, ma'am.
Hello.
Ma'am, your voice is not clear, ma'am.
Now. Now, can you able to hear me?
Yes, ma'am.
Okay. Then comes life stage in the modern concept. Already I explained what are the Ayurvedic concepts. The modern concept: infancy up to 1 year, early childhood up to 6 years, late childhood up to 12 years, adolescence 12 to 20 years, early adulthood 20 to 40 years, middle adulthood 40 to 65 years, and late adulthood 65 years onwards. This is according to Ayurveda, what up to 30 years according to Charaka childhood, but modern concepts they had taken up to 12 years the childhood. When adolescence up to 20 years, in Ayurveda we had taken up to 40 years. Then we have to go for the next slide. Then what are the stages of life? You can see here from the baby to the old age. Then next, what are the physiological changes and pathological conditions in Balya? Physiological changes, already I explained the physiological changes, that is Dhatu Avastha, Aparipakwa Dhatu Avastha, and Dika Pramana Vruddhi. So in modern concept also, the bodily development occurs in the initial stage. Then according to Ayurveda, Kapha Pradhanya, body growth occurs, fine gross motor development occurs, speaking, everything development occurs, physiological jaundice also occurs during that time. Then next, Maharshi Sarangadhar, he mentions 1 to 10 years Balya Rasa, 11 to 20 years Vruddhi Rasa. What is the context between it? What is why he mentioned Balya Rasa? Because all those things what is occurs now, that will never occur afterwards. Whatever the student, whatever the child will do in these 10 years, that will never he will do in the afterwards. So Balya Rasa, further research is required on this point. And 11 to 20 years Vruddhi Rasa, because in modern concept also they accept the maximum growth occurs within 20 years. Then pathological. So due to all those things, what are the diseases? I am taking only the diseases what we are treating now, and we are getting the successful result. So in the childhood specifically, we are getting Swasa, GIT diseases, that is Uddara Roga, Danta Paligata Roga, and Krimi, Twacha Vikruti, Phakka, Balapakshagata, and the jaundice, autism, etc. So once again, I want to show you what are the diseases we are facing. Swasa, Uddara Roga, facing, we are treating Swasa, Uddara Roga, Danta Paligata Roga, Krimi, Twacha Vikruti, Phakka, Balapakshagata, etc. Autism, DMD, but where we are getting the successful result. Now, Panchakarma in Balyabastha. What are the Panchakarma we are giving in the Balyabastha? Specifically, we just listen, we deal for the Swasa patients. Specifically, we are giving the Salwana Sweda. But in the up to 10 years also, in the 9-year baby girl, we had given the Vamanakarma. And very nicely, that's why I am explaining, don't be brave when you are administering the Panchakarma therapy. For the 9 years girls, you had given the Vamanakarma. For the 10 years boy, you had given the Vamanakarma. So, for the 9 years girl, okay. Hello, it is audible? Hello?
Yes. Yes, ma'am.
Hello, it is audible?
Yes, ma'am.
Ma'am, it is not clear, ma'am.
So Salwana Sweda. So for this Swasta, we are giving mainly commonly we are giving the Sweda. Yes. For the 9, yes. So my voice is clear. Okay. So for the 10 years girls, 10 years boys, we are giving the Vamana karma should do small age also. But before that, we should be careful about the mental conditions of the and physical conditions of the patients. Then for the we had given the Madan Phala Vamana and for the Swasa case, and for the skin problem, usually we are giving the Nimba Kasaya, little bit of Nimba Kasaya we are adding during the administrations of the Vamana. Then followed by Virechana. In case of Swasa, in the small children, we are administering also the Nitya Virechana for the student, for the patients. Then comes Dantapaligata Vikruti. In the Dantapaligata Vikruti, specifically in the gum bleedings, gum infections, in such type of conditions, what we are thinking, it is not be curable in the Ayurveda, but Ayurveda, the Panchakarma depend is acting nicely, very nicely in the gum bleeding, gum disorders. Also for in the small kids also, up to the 10 years and 16 years of the age. Rakta Mukhyana. Rakta Mukhyana, which type of Rakta Mukhyana are giving? Simple. The little, the Sira Vedana, sorry, the scalpel and remove the blood, what is the deposited there. Then after that, the Gandusha. Gandusha, we have to administer Lavana Daka Usma, Lavana Daka Gandusha we can give, and Panchavalkala Kwatha. Panchavalkala Kwatha Gandusha, it is highly effective. Panchavalkala Kwatha Gandusha you give for 10 to 15 minutes, we have to administer, we should for the small kids, because they are not able to keep it for so long time up to the Nasa Srava and Netra Srava like that. Simple for 10 minutes if they will keep, it is well and good, because we have to consider the age also. Then Jatiyadi Taila Pichu. It is excellent. It shows the excellent results. It is I am very much confident about these things. Please follow and don't think that it is not. We cannot treat the small kids for the by means of the Panchakarma. So next cases what we are dealing, that is Krimi. Krimi infections. In case of the worm infestations, in case of Krimi, in my practice, we are giving Sabdya Virechana with Nimba Amrutadi Arandataila. Sabdya Virechana with Nimba Amrutadi Arandataila twice monthly. You can give based on the conditions and based on the conditions of the kids. Then after that, following the Haridra Bidanga Kalka. Haridra Bidanga Kalka, you have to prepare in the ancient time also. The in a normal home also, the people preferred the Haridra Kalka for the for those Kruminasana. Just adding Haridra and Bidanga here. Then comes the Twacha. In case of Twacha Vikruti, so in case of in small kids, so many Bicharchika, Kandu, Kitiva Kushta, all those things are coming. That how and Darunaka, these things also coming. And what we are doing, same thing, Vamana. That's why I am telling, don't get fear to administer Vamana to the small kids. You can. If you are not able to administer the classical Vamana, you can go for the Sadhya Vamana, Nitya Vamana. Nitya Vamana, for if it is small kid, you can advise our parents to give the Nimbo and Lavanodaka Vamana at least once in a week. Then you go for the classical Sadhya Virechana and Kaya Seika. Kaya Seika you can give with the Mohamanjista Taila or Triphala Kwas based on the dosha. Once again, same thing. One I want to clear you. First, we have to be clear about the dosha pradhanyata. Which dosha pradhanya it is? Because Vikara Nama Kushala Na Jihiya Kadachana. Sometimes we are not able to give the name of the digits. We should be thorough about the dosha Khaya Bruddhi Lakshana we should be very confirm about the dosha Khaya Bruddhi Lakshana. Then which dosha pradhanyata is there in that particular tocha vikruti, whether kapha vikruti, itching is more, chotha is more, then kapha vikruti is there, then we are giving the vamana. If it is the burning sensation is there, bleeding is there, pakha is there, we should better to go for the virechana, vidya virechana or sadhya virechana based on the condition of the patient. Then takradhara. Having the scalp psoriasis, in that cases we are giving the takradhara also. It is highly effective, and in the takra, instead of the amalaki decoctions, you can give the yasti madhu, the manjista decoctions for the takra preparations. So kirapaka with manjista, it is highly effective for the takradhara. Then comes balapakyagata. Very commonly we are using Sastika Sali Pindasveda for the Balapakyagata and Matrabasti. Most probably most of the centers they are using the Matrabasti either with Mahamasa Taila or Bardhamana Grita. Mahamasa Taila or Bardhamana Grita. And also we are giving the Mrudu Virechana. So many cases we are, but 100% guarantee we cannot give. But most of they are improving their condition is highly improved. And cerebral palsy also, we are treating also cerebral palsy, that Brahmi Gruta Pichu we are giving, along with that Mrudu Abhyanga with Kiravala Taila. But and DMD cases also, but autism also, just we can improve their life. We can improve their lifestyle, that much only. We cannot give 100% confidence on that. But Swasa, Dantapaligata Vikruti, Krimi, Tochakata Vikruti, 100% you can go through it, but repeated, we have to advise them to repeat it at least minimum 3 months gap, that because it is nowadays it is not practically possible for the patients. Then coming for the next, that is what are the changes in the early adulthood, and I want to discuss about the Madhya Avastha. So Madhya Avastha, in the modern concept, they divide it into two parts, that is early adulthood and mid adulthood. In the early adulthood, typically physical development and maturation is already complete. Maximum physical development, Ayurveda also accepted, and small percentage still gain in the height in early 20s. Some of them after early 20 also height gain occurs. Brain continues to grow in height and weight, reaching its maximum during early adulthood. So maximum growth of the development of the brain occurs in the early adulthood, and then contracting in size. Please remember this thing. So maximum health, the brain development occurs in the early adulthood, then it contracts. So in Ayurveda also Sarangadhara tells Medhahani after that. Please interlink those things, then you can able to. So that's why Medhya Dravya we should use to start after the early adulthood. Please connect all those things. So Medhya Dravya we can use, we can enhance our mental capacity by doing all those things. We can take the Shirodhara for this, because after that it contracts. Then comes senses are typically at their peak, means all the Indriya activities are in their peak level. Most of us are at our peak of psychomotor abilities during early adulthood. Reaction time quicker, muscle strength greater. Obviously, Mansa Bruddhi, hand and eye coordination sharp. Remember these things, hand and eye coordination is sharp, means everything we can do very sharply in that particular age. Early adulthood. Gradually, in the late adulthood, which starts after the 30 or 35, based on the conditions of the, it varies from person to person. Purusha, it varies from persons to persons, because to differentiate between late adulthood, it varies from persons to persons. So what are the changes occurs in this stage? That is, the mental growth occurs, the physical growth occurs, muscle strength become greater in this early, become sharp in this stage. Then next, you can see the stages. You can diagnose it as the early adulthood. Then early adults depend on the person's but usually from person to persons. Purusha Purusham Vikhyam. But usually up to the 40 years of the age, you can consider. Then physical development is complete. In Ayurveda also it is mentioned that Sampurnata. Maharishi Charak mentioned Sampurnata. Physical development is complete and most people are at peak health physically. Important events include developing relationship, a career, solidifying beliefs, etc. So, independent roles, the parenting also occurs. So, these are the stages. Then comes next. These are the some pictures once again, early adulthood. So next is normal physiological development in the early and middle adulthood. Early adulthood, peak muscle tone and joint functions. Middle adulthood, what happens? Gradual changes. Lose height means in the middle adulthood, there is no growth of. Basically, everybody know weight gain occurs in the middle adulthood. Then 40 in Sanghamitra explain also hair thins, thicker fingers, finger become thick and yellow teeth. These are all the symbols of the middle. These are all adulthood. So why I am telling, why I am discussing these things in between the treatment? Because everything we have. Next is what is the physiological changes in the next is physiological changes and pathological conditions. What are the physiological changes occurs as well as what are the pathological conditions occurs? Then I tried to differentiate it of the srotas. Then what are the physiological changes? Obviously, in the middle age, it is 60 to 70. According to Charaka, it is 30 to 60. But I had taken here the opinion of Sushruta. 60 to 20 is Vruddhi Avastha. Modern concept also accepted. 20 to 30 is Yauvana Avastha. To finishing, Vivardhamana Dhatu Avastha. Hani Avastha means during this time the degeneration starts. So we should be very much careful after that stage, because up to 40 there is whatever the disease will occur, we can treat it with very less effort. But we next is what are the according to Sarangadhar, what hani occurs within this Madhyam Avastha? Within 21 to 30 years, the luster gets reduced. Within 31 to 40 years, the medha, already I told in the modern concept also, they told the skin, the maximum growth of the brain functions occurs. Within 41 to 50 years, tocha hani occurs. Within 51 to 60 years, drushti or vision hani occurs. So that is the pathological conditions. So these are about the physiological changes occurs. Now you can see about the what are the pathological condition in Madhyam Avastha. You can see in the picture also different types of the mental depression, menopause. You can see the menopause here, different types of the mental harassment, hyperacidity. So many pictures they show here, hypertensions. So these are all the commonly practiced diseases which we are practicing in the day-to-day life in the Madhyam Avastha of the patients. So then of the human being. So I try to classify it under the different sorts of the srotas. For the srotas, what are the age-related changes and what are the pathological conditions? We are observing in the mainly we are observing in the day-to-day practice. In the pranabha srotas, Agni Mandya, Srota Avaradha, Pratiloma Gati of the Vayu occurs during that time due to our different sorts of the Bihar, different sorts of the Bihar what we are taking, we are our day-to-day lifestyle, the Pratiloma Gati of the Vayu occurs, Pranavayu occurs, which leads to Swasa and dust, everything. So we are exposing ourselves to the dust and all, which leads to Swasa. Then Udaka Bhasrotas, fluid and water balance. During this Madhya Avastha Vata Pitta Prakopa occurs, which leads to Udaka Bhasrota Vikruti, which leads to Aruchi, as well as Trushna. Loss of appetite is very common symptoms during this time, during this the present scenario. Lack of digestion, loss of appetite. So next is Anna Bhasrotas, GIT, gastrointestinal system. Manasika Vishamata occurs, Agni Nasa, disturbances in the esophageal motility. What happens during that times? In the disturbances occurs in the esophageal motility and reduced peristalsis. This is very common in the Annabhasrotas in the middle age. Then what happens? What are the pathological conditions we are facing due to all those changes? That is Aruchi, Amla Pitta, which is a very common problem in the present scenario in the Madhyam Avastha. Then osteoporosis also and liver disorders. Then these are all the pathological conditions we are facing in the day-to-day, and also the Rasabhasrotas Vikruti. Then comes Rasabhasrota Vikruti due to lack of nutrition to the dhatu, due to lack of, because nowadays in the present scenario everybody is running for the money. So their diet habits, they are not taking the proper diet in proper time. Due to that, Agnimandya occurs, and due to that, Dhatukya occurs, and Dhatukya leads to Balakya. And due to this, what happens? Yearly Balipalita starts. Yearly Balipalita starts. Wrinkling, the dryness, everything starts in the gray hairs, bald hairs, all those things occur in the early middle age. Then comes RA and SLE. RA and SLE, these are also the common Rasabhasrotas Vikruti which we are facing in the present scenario, in the middle age. Then Raktabhasrotas, Raktadushti and menopause also, it is one age-related changes. Then pathological conditions we are facing in the Kushta, that is Pitiva Kushta, Bicharchika, so many types of these skin disorders we are facing. And Vyanga is also very common nowadays, and hypertension. In Mansabhasrotas, muscular system, muscular systems, mainly what happens? Lean body muscle mass occurs during this period. Mansakya occurs during this period. Why? Because lack of exercise. Because lack of exercise and overeating. So what it leads? It leads to mainly either Mansakya or Sthaulya. It leads to usually either Mansakya or Sthaulya. Then Asthibhasrotas. It is a very important area for the Ayurvedic physicians, for the Panchakarma people. Asthibha Srotas, people are coming to us mainly due to these diseases. So gradual asthikya occurs and asthibheda occurs. So what it leads? It leads to Kesa Vikruti, the hair fall, asthigata vata, sandhigata vata, asthibhagna, etc. So many cases we are facing here for this in our day-to-day practice. Then comes Majjabha. Mainly Majjabha Srotas Vikruti, head drilling occurs, loss of conversations occurs. Then what it leads to? It leads to fall. Then comes Nadibha. Nadibha is Shirasnayu Sankocha occurs in this time. So what it leads to? It leads to Pakhyagata, Ababahuka, Kampavata, and Grudrasi. Such type of diseases we are facing in our day-to-day practice. And Sukra, obviously due to our change in lifestyle, Anuloma and Pratuloma Khyaya occurs. And due to that, Alpa Sukrata and Sukrakhyaya, Alpa Sukrata and Sukrakhyaya occurs we are facing. And in our day-to-day practice also, these cases are coming in maximum number. Then comes Purishabha Srotas. Purishabha Srotas, what happens in the Purishabha Srotas in the due to this age? Dhatukhyaya. Due to Dhatukhyaya, Vata Vruddhi occurs. Due to Vata Vruddhi, the improper intestinal motility occurs, and which leads to Koষ্ঠকাঠিন্য. It is very common problem. If Koষ্ঠকাঠিন্য will there, definitely all sorts of metabolism will be hampered, and it leads to so many types of the diseases. Then Mutrabha Srotas. It is what happens in this? Gradual decrease of glomerular filtration rate occurs, and prostatic, in this age, prostatic hyperplasia occurs. Obviously, gradual decrease of the glomerular filtration rate and prostatic hyperplasia. What it leads to? It leads to Madhumeha, Asthila, means that is enlarged prostate, etc. Then Shvetabha Srotas, Ati Shveda, Ashweda, and in the Madhyama Vayasa, which that starts from the 16 to 70 years, Yavana Pidaka is a very common problem. Ati Shveda and Ashweda is also commonly, of course, it is rare case Ati Shveda and Ashweda, but we are dealing with these type of patients in our clinical practices. Then comes Indriya Pradeshaja Vyadhi. Already I told the Drushtikhyaya, Indriyakhyaya, all those things occur. So Indriya Sakti Hani, Sparsha Jnana Nasa, and in this age, if modern concept we will think, then cataract, presbyopia, hearing loss, taste loss, everything occurs also during that time. Then we have to go for the what is the modern concept? Physical development. Body not able to do the things it used to during these times. Already Pathasranti. Remember our classicals, the Harita mentioned Pathasranti. They cannot able to perform their regular duty after the age of 40. Athletic means they feel tired. Athletic ability relates more to a person's self than menopause. Obviously, this is the stage where menopause occurs. Late adulthood brings changes with it too. Physical changes susceptible to short-term illness. Obviously, very little time they become ill, and neurons in the brain begin to die. So recognition declines. But in this age, the persons becomes satisfied up to 50%. Then the things occurs. Then comes what are the Panchakarma in the Madhyama Avastha. We have to, I will discuss about the practice. What are the, in Madhyama Avastha, already I told, system wise, the Srotas wise, what are the diseases in the middle age we are facing. And based on that, what type of Panchakarma, successful Panchakarma Chikitsa we are giving, and we are getting the good result. Just only that part I am discussing. That is Pranava Srotas. Already in the Balyabastha, I discussed that part. Swasha. And without any fear, we are conducting the Vamana. Particularly in those cases, if the Snehapana during this time, it is better to advise Dipana Pachana properly. Properly Dipana Pachana we have to give. Then we have to go for the Vamana, Abhyanga. Based on the patient's condition, we should plan for the Sadhya Vamana or Nitya Vamana or classical Vamana. Then followed by Nitya Virechana. So Vamana is next is Udaka Bahasrutas, Aruchi, and here what we are giving, Mrudu Vamana we are giving for the loss of taste, lack of, that is also so many patients, they, not maximum number of patients I deal in my practice life, but lack of taste, loss of taste, in those cases, we are giving Lavanodaka Gandusha, Lavanodaka Gandusha, followed by Mrudu Virechana. Remember it, Kosta is very much important, Agni, Kosta, Nidra. These three concepts we have to give more emphasis on those things. So when we are, please ask to the patients regarding Agni, Kosta, Nidra, and mention these things in your prescription also. In your prescription, what is the status of the Agni, what is the status of the Kosta, what is the status of the Nidra, always try to mention it. And after your 15 days of treatment or 1 month of treatment, try to assess it. If Agni is becoming correcting, then you think that you are getting the successful result. And Kosta is gradually it is correcting, then definitely you will get the successful result. It may take more time, but it will definitely will get the result. Then comes Anna Bahasrotas, Vamana and Virechana. Hello. In the Anna Bahasrotas, Amla Pitta. Very commonly we are facing the Amla Pitta. Then for that we are giving the Vamana for the Amla Pitta patient, followed by Virechana and followed by Samana Ausati. For the Rasavaha Srotas, the Arochaka and Balipalita, Amavata, mainly we are facing. And for the Arochaka and Balipalita, we are giving the Virechana specifically. And for Amavata cases, multiple type of therapy, multiple type of basti, multiple, जैसे कि रुक्ष, Sheda, Lavana, Lavana and Lasuna, Lavana, Lasuna, Sheda we are giving. That is Baluka Sweda also we are giving. Along with Lavana and Lasuna Sweda also we are giving for the Amavata, and it is getting very good result. Then next is Basti therapy. Here I want to share my views about the Basti therapy, because we are giving for the Amavata cases, we are giving the Vaitarana Basti also, the Erandamuladi Nirva Basti also. But Vaitarana Basti is acting very nicely. More than 100 of Vaitarana Basti we are giving to the patients. But in my practice life, in one case I have seen, after giving the Vaitarana Basti, means that is Gomutra Yukta Vaitarana Basti, one case the ESR gets increased. He never get the proper result from the Vaitarana Basti. Instead, his ESR gets raised. So immediately what I do, what I had done, I change it to the Erandamuladi Nirva Basti, and after that the patients gets improved. So not that, that's why I am telling, not that Amavata patient is Vaitarana Basti. No, first of all we have to think about that, whether we have to administer only Basti or Rukhya Sweda followed by Basti, whether it is newborn or it is chronic Amavata case. Then if it is chronic Amavata case, definitely with deformity, then the treatment schedule will also change. Then next comes is, that's why Purusang Bhikhya we have to check it. Then Rakta Bahasrotas, Kitiva, Vicharchika and Vyanga. For the same part what I have discussed in my the Balyabastha, for the Kitiva we are getting Sodhana for the any sorts of the skin diseases. Sodhana is compulsory. If we add the Sodhana based on the availability of the patients, based on the strength of the patients, we have to select which type of Sodhana we have to give, and based on the Dosa Pradhanyata also we have to think which type of Sodhana we have to give. Whether if it is Kapha Pradhanyata, then Vamana we have to select. If it is Pitta Pradhanyata, we have to select the Virechana. And it is better always, from my point of view, please, if the patient is even Pitta Pradhanyata, based on the definitions of the Sarangadhara Vamana definitions also, even if Pitta Pradhanyata, if we start from the Vamana in case of the skin diseases, definitely we will get the excellent result. Vamana followed by Virechana, followed by Lepakarma, and if the Rakta Mokhana also, in some cases we are getting good result from the Rakta Mokhana leech application, specifically Prachana Karma also we are giving, and Prachana Karma, Sira Veda in very less case, but Prachana and Jaloka Avacharana we are giving. next stage. So we are getting the very good result from this. Itibha vicharchika vyanga. For the vyanga also, it is very good to administer Vamana Virichana followed by the lip. Giving for the Gandamala also, the Shodhana Nasya we have to give, that is Shadbindu Taila Nasya we have to give. So Medabhas.
Hello, ma'am.
So next comes the most of the centers there. Then, so for this Taulya case also, one thing I want to explain you, be confident and advise the patients that once we will give the Vamana Virechana, whatever the Shodhana is, and the weight will be less. No. Repeatedly they have to take the Shodhana, and then only they can get the result. Then comes Asthiva Majabha Srotas, Asthikhyaya, Pakshaghata, Sandhigatavata, Grudrasya and Avavaka. This type of cases we are getting. For the Asthikhyaya, what type of treatment? Mainly we are giving Gugulu Tiktaka Gruta Matravasti. It is highly effective, and 100% guarantee you can take for the Gugulu Tiktaka Gruta Matravasti, Hiravala Taila Matravasti, Mahamasa Taila Matravasti, and we are also in our day-to-day practice, we are doing mix the Gugulu Tiktaka Gruta with Hiravala Taila. We are doing mixing the Sneha, both the Jamaka Sneha, and we are advising the we are suppose in one case I am sharing, in Sandhivata case also we are giving Matravasti along with the Mahabhishagarbha Taila with Gugulu Tiktaka Gruta, and it is also highly effective. So then Pakhyagata, if it is Pitanubandhi, the Virechana we are mainly preferring. If it is Kaphanubandhi, we are administering not the Vamana, mainly we are not administering, but Mrudu Vamana you can give, but specifically we are giving the Basti therapy there in the Kapha Vata Erandamla the Niru Basti, where the Sneha we are giving Mahamasa Taila. So that is the work of the physicians to change the in the Basti Dravya, to change according to the person's conditions. We can take the Niruha Basti, what Niruha Basti we can give, that depend upon the patient's condition, and what type of Anuvasana we have to administer, that we have to think based on the condition of the patients. But specifically we are giving Mahamasa Taila Matra Basti, the Khiravala Taila for the Pakhyagata case, then for the Sandhigata Vata, Gugulu Tiktaka Gruta, for the if Virechana is the Erandamula the Gandravastadi Taila, Matravasti also we are giving as the Virechana. So next is for the purpose of Virechana, next is Grudrasi. Grudrasi, first we are diagnosing whether it is Vata Pradhanyata or Kapha Vata Pradhanyata. If it is Suddha Vataja, then we are advising Kati Basti followed by Matravasti. If it is Kapha Vataja, we are advising specifically the Yoga Basti or Karma Basti or Kala Basti, depending upon the severity of the patients. So in Yoga Basti also, whether it is Vedana Pradhana is there or Sotha Pradhanya is there, based on that we are selecting the oil and we are selecting the Vasaya Dravya. Then comes Avabahuka. Avabahuka, everybody knows that the Avapidaka Sneha also, because in the upper part of the body, the Avapidaka Sneha is also useful. Then Avabahuka, but we are practically in day-to-day practice, we are using Abhyanga, Nadi Sweda and Nasya Karma. Particularly, we are giving the one patient, the above, it was one thesis topic, Jinghinyadinasya, it was highly effective in case of the above. I have also forgotten the Yauvana Pidaka. In Yauvana Pidaka also, the Vamana Karma is highly effective, and we are advising and in the clinic level also, the patients are coming for the Yauvana Pidaka, and Vamana Karma followed by Lepa Karma, it is highly effective, and followed by Sansamana Ausati also. So please don't forget to advise the Vamana followed by Virechana, it is highly effective in my clinical practice. Then comes Sukravasrotas. Sukravasrotas, in case of the Sukrakheya and Bandhyatva, in those cases, nowadays it is a burning problem, burning issue of the society. So some of the cases we are getting very successful here. Hello. Some of the cases we are getting successful. In some of the cases also we are becoming unsuccessful. So this is my sincere request that don't get frustrated if one case is become unsuccessful. So because we have to treat with full of confidence, and but history taking, it is very much essential, and we have to provide, and in these cases we are giving the Sampurna Sodhana, that is Vamana followed by Virechana, and in case of the sperm count is less, we are giving the Sukrakaraka Basti, Madhutailika Basti also we are advising, and for the female, the specifically we are going for the Vamana followed by Virechana and followed by some Sansamana Ausadi, just Phalagrita, Kalyanaka Gruta, this type of medicines we are advising. For the Matra Basti also we are giving, and Uttara Basti is also effective. Then comes the next. Purishabhasrotas, that is Kosthakaঠিnya. Purishabhasrotas, already I am telling, it is very common, is Kosthakaঠিnya. Atisara, nowadays it is very rare, and if they face also, they are not coming to the clinic level. So Kosthakaঠিnya, it is very common things, and there we are giving Matravasti followed by Virechana. One thing, if it is Kosthakaঠিnya and Vata Prabhuta Avastha, directly don't go for the Virechana Karma. It is already mentioned in our text also. For the Atyadika Kosthakaঠিnya, it is better to go for the Basti followed by Virechana. So otherwise Virechana will not act directly if you will administer that. So Niruvabasti, actually science told that to advise the Niruvabasti followed by Virechana, but in day-to-day practice we are giving Matravasti followed by Virechana. And Matravasti, we are giving Matravasti with the Sahacharadi Taila or Kiravala Taila we are giving, and Kosthakaঠিnya, it usually occurs in the suppression, continuous habit of the suppressions of the natural urges. So please advise your patients not to do all those things, then it will come for the chronic Kosthakaঠিnya, and it will be very difficult to clear. Then comes, in my practice life also, I faced so many cases about the Kosthakaঠিnya due to the suppression of the natural urges. So please advise your patients not to avoid the suppression of the natural urges. Then comes Mutravasrotas, the Madhumeha and urinary tract infections in the middle age. So for the Madhumeha, we are giving the Virechana with Nimba Amrutadi Eranda Taila. Virechana with Nimba Amrutadi Eranda Taila, it is effective. Repeatedly, we have to continue all those things along with diet and physical exercise. And yoga also, it is preferable during that time. Surya Namaskar is also essential during that time, because physical exercise is definitely required for the case of the Madhumeha. And for the urinary tract infections, Prakshalana, it is very much essential to go for the Virechana followed by Prakshalana. Virechana, after that, you should advise. Normal Virechana you can advise. After that, because Adhagata Vikruti, it is better to go for the Virechana and followed by Prakshalana. Then comes Nimba decoctions, Nimba Khadira decoction Prakshalana. It is highly effective in the urinary tract infections. Then Swedava Srotas Vikruti, Atisweda, Asweda. One thing, Yauvana Pidaka, Atisweda and Asweda. One Atisweda patients I face, they are the IT people, Atisweda. They are complaining about Atisweda from the beginning. From this, since adolescence, they are atisweda, they are unable to write. They are the so much of sweatings is that they are unable to keep the papers, keep anything, it will become watery. So in those cases, simple virechana is highly effective. Simple mrudu virechana. First you advise, I had given simple mrudu virechana followed by the Arogyavardhini and Abhrarasa and like that. So Laghusuta Sekhar and Arogyavardhini combination, first virechana followed by this, and it was highly effective and which was beyond my expectation also. So next comes Indriya Vikruti. Indriya Vikruti, already I told that Drushti Nasa, Shruti Nasa, Sparsha Jnana Nasa and Smruti Nasa, these are all the cases what you can able to see in your practice life. So Drushti Nasa, already I told that Nasya Karma followed by, in case of Drushti Nasa, Nasya Karma followed by Netra Tarpana Chikitsa, it is highly effective. So next is Shruti. For the Shruti Nasa, the Karna Kheda and Karna Nada, these are very common things that is coming. It starts from the after 50 to 60 years, the people are complaining Karna Kheda, Karna Nada, and Shruti Nasa very rarely, but Karna Kheda, Karna Nada is very common. So in that case, we are giving the Karna Purana with Khira Balataila. Karna Purana with Khira Balataila, it was highly effective, but we have to conduct the Dhumapana after that. We have to conduct the Dhumapana after that. Then comes Sparsha Jnana Nasa. Sparsha Jnana Nasa, Abhyanga and Svedana, repeated Abhyanga and Svedana. First, that's why the internal purification is excellent. So the excellent work on that, that is Abhyanga, Vamana Virechana, followed by Abhyanga and Svedana, repeated Abhyanga and Svedana, it shows excellent result in the Sparsha Jnana Nasa. Then comes Smruti Nasa. For those things, I will advise the Smruti Nasa, that is Pichu, Brahmi Gruta Pichu, Nasya Karma, followed by Brahmi Gruta Pichu, etc. Then come the next, that is physiological changes and pathological conditions in the Bruddhabastha. What are the in the Bruddhabastha? According to Maharshi Sarangadhar, what is the physiological changes occurs? Hina Bala, the strength, definitely everybody know it. Hina Bala. Maharshi Harita told Hiyamana Dhatu, sorry, Maharshi Charaka told Hiyamana Dhatu Avastha, means Dhatu gets decreased, and Hina Atma also. During that time, the strength, mental strength also decreases. So this is the stage of process of decay. So that is above 60 according to Charaka, above 70 according to Susruta. So Sarangadhara mentioned what are the things get deteriorated during that time. 60 to 70 Sukrahani occurs. Obviously 70 to 80 Vikramahani. Obviously Sukrahani, if it will go there, definitely Vikrama means strength will reduce. Then 81 to 90 Buddhihani occurs. If everybody have their parents, 90, 80, after 80, they are just like the children. In the society, it is told Bala Bruddha is just like same. So after 80 to 90, 81 to 90 years, the Buddhihani occurs. Then 90. So why I am discussing this? Based on that, we should advise the treatment. Then 91 to 100, Karma Indriya Hani occurs. So they are unable to, usually they are unable to move properly. So what is aging? Aging old age, that is tissue damage occurs, natural selection occurs, decline of loss of cellular function occurs, dropping of the numbness of the cells, oxidative damage occurs, DNA modifications occurs. Just now what the Sarangadhara told, same things it is mentioned in the modern concept also. And why? Because during that times unhealthy lifestyles occurs, because due to the age, due to the laziness, they never follow the proper lifestyle, and due to all those things, these decline occurs. So next stage, what are the pathological conditions? You can see the one old persons, they taking the hermesis with the with one cart. You can see. So locomotor Hani, locomotor hani. This is the symbol of this age. And in Vruddhabastha, here also another case you are observing here. And in that cases, what to do, that I am now going to discuss. Same Pranabhava Srotas, based on the Srotas I am discussing Pranabhava Srotas. In this case, in this age, what happens? Depression of immune systems, mainly due to the irregular lifestyles and due to the irregular food habits, everything, depression of immune system occurs, and pratiloma gati of vayu, and poor oral hygiene also occurs. During that time, they never used to. That's why in the beginning I told Dinacharya Shodhana starts from the Dinacharya. So Panchakarma, the Nashya Karma, everything, Gandusha, whatever they are mentioned is there, we have to follow it properly. Jiha Nirlekhana, Danta Prakchalana. So in the old age, due to their laziness, the poor oral hygiene occurs. So what are the diseases very commonly? Swasa, viral pneumonia, oropharyngeal infections occur. So during that time, it is not possible to conduct the Vamana properly. So you can advise in acute conditions, you can advise the Nitya the Vamana simple by the Nimba and Lavanodaka Vamana. It is 1 glass or 2 glass you can give and they can excrete it. That is not a big issue. That is not so dangerous also. And for the oral hygiene, very foul smell occurs in the normal in this age. So for that, Lavanodaka with Tankana, Gandusha, you can advise, and Irimeda di Taila Gandusa, you can advise. It will, and Madhu Gandusa also you can advise. And it removes the foul smelling. And side by side, you should advise to take care of the oral hygiene for those patients and avoid the dust and everything for those patients. Then comes the Udakava Srotas. Due to the, it occurs mainly in the old age. So due to the disturbances in the water fluid or water balance, the dry skin occurs and dry throat occurs. They get feel the Trishna frequently. So supplementations of water supplementation is required, and due for the dry skin, again and again, Abhyanga Macharita Nityam Sajarasrama Vataha. So Abhyanga is the very good treatment during the old age. Then comes Annabha Srotas. You very commonly they face the loss of appetite. This is a very common thing. We have to convince them a lot to take the food. They are not able to take the food, and gastritis also they face in that times. Then comes Rasava Srotas, loss of appetite, and Balipalita, RA, SLE. These are all the diseases what you can see in those time. Then comes Raktava Srotas, risk of heart diseases are many in these ages is more than Mansavaha and Medavaha. Lean body muscle mass. During that time, what happens? Lean body muscle mass occurs. Muscle mass gets reduced and atrophy of the muscle cells occurs. And so due to the atrophy of the muscle cells, what happens? The decreased locomotions. The one picture I showed, decreased locomotion and fat accumulation become more. So what happens? Atrophy of the muscle cells, Mansaka atrophy happens, then lean body muscle mass and fat accumulation. So all those things what it causes the decreased locomotion. So China, what is the pathological condition? China, the patient became China, and also loss of movement occurs during that time. Then Ashthivaha and Majavaha Srotas. Due to this age factors, what happens? Degeneration of the cartilage occurs. Degenerations of Asthikya. In Ayurveda also it is mentioned. Due to the Vardhakya Avastha, Vatavrudhi occurs, which leads to the Asthikya. Then comes formation of the marginal spur occurs. During that time, formation of the marginal spurs, subchondral bone thickening occurs. Subchondral bone thickening, which can cause the reduced joint space, and wear and tear due to that. Wear and tear occurs due to the vayu aggravation. So subchondral bone thickening, wear and tear due to all those things, and the degeneration of the cartilage. What happens? It leads to the degenerative joint disorders. It leads to the degenerative joint disorders. And Sukravaha, obviously the Sukrakya occurs, which leads to the lack of strength. Then comes Purishava Srotas. Again, same things due to the Vata Bruddhi, decreased intestinal motility, If intestinal motility became decreased, then what happened? The stool gets stored more time in the Pakwasaya and get, obviously if it will remain more time due to the Vata Bruddhi, due to the Rukhyata, dehydration, the stool get dehydrated and loss of sphincter control. So if the stool get dehydrated, then what it will cause? It will cause the chronic constipation. Then loss of sphincter control. During that time, due to the Bikruti, loss of sphincter control occurs. What it leads? It leads to fecal incontinence. It leads to fecal incontinence. Then Mutra Srotas, sensation. Remember, in the old age, frequently they want to void the urine. Why? Because in the normal healthy human being, what happens after the bladder get filled, before the 50% of the bladder get filled, they want to void the urination. But in the old age, what happens? They unable to realize that that their bladder is getting filled. That's why what happened? The incontinence of urine occurs. Automatically the urine flow occurs. So that happens due to the age. This is age-related factor. So urinary incontinence, and either urinary incontinence or mutra kuchra also occurs due to the prostatic hyperplasia. Then comes Indriya Vikruti. Due to the Vata Vruddhi, excessive Vata Vruddhi, due to the excessive Vata Vruddhi, the Indriya Kshaya occurs. So which leads to loss of vision, loss of smell, lack of elasticity of the skin, and memory loss. Then comes, this is the late adulthood. What is the picture of the, according to modern concepts? People after 65, people live longer than, nowadays the longevity of the human being is becoming more. So in the 90s, 1 in 30 lived more than 65 years. In 2020, nearly 1/5 will be more than 65 years. So the longevity is becoming more. Then physical changes. What are the physical changes? Wrinkling, folding of the skin, less elastic skin, senses less sharp, that is hearing, vision, smell. Already my Sarangadhara opinions I had explained all those things very nicely. Then health problems from brittle bones, bone problems, increased fracture due to the impaired locomotion, the increased fractures occurs, danger of fall, immune system became very less, so can maintain. So that's why what is the treatment? We have to advise them to maintain the health by conducting different physical exercises, going for the small type of panchakarma, means para panchakarma procedures like abhyanga, swedana, this type of things we can advise during that time, not the proper matrabasti you can advise. So panchakarma in the Vrudhabastha, you can see the picture. That is one of the Sandhigata Vata patients in our hospital, Dhara Chikitsa. So such type of Chikitsa we can give in those area. So Pranabhava Srotas, Swasa or COPD. This is very common, COPD, chronic obstructive pulmonary diseases. So there we are giving in the old age Abhyanga with Lavana Sneha and followed by Nadi Sweda and Abhyantara Snehapana. For those cases we can give the Abhyantara Snehapana, Kontakari Gruta Sneha, like that in less quantity we can give. Then Udaka Bahasrotas, Aruchi, Lavana Jalagandusha, already I told, Lavana Tankana Jalagandusha, we are giving in the old age. Try to avoid maximum Panchakarma unit during that times. Then Anna Bahasrotas, Agnimandya Amlapita is also very common. So Mrudu Vamana, you can give Mrudu Vamana with Lavana Jala, followed by Gandusha and Samana Osadi. Then Rasa Bahasrotas, that is Balipalita, it is very common. For that, you can advise the Mrudu Abhyanga, Shvedana, and based on the condition of the patients, you can advise the different treatment. Then Rakta Bahasrotas, that is hypertension. In those cases, very common hypertension and skin problem also very common in this time. So hypertension in those cases, very commonly we are teaching, we are preferring the Dasamula Khira, Sirodhara and Siropichu with Brahmi Gruta and Nitya Virechana you can give to the patients. Then Mansavaha and Meda Bahasrotas, Mansakhyaya and Staulya, same matra. For the Mansakhyaya, we can go for the Matrabasti with Mahamasa Taila. Matravasti with Mahamasa Taila and Thirabala Taila alternately we can give for the Mansakhyaya. And Mrudu Virechana, so for this Thaulya patient, we can give Udvartana followed by Mrudu Virechana. Don't go for the Lekhanavasti and all for the older patients. Then comes Asthi and Majabahasrotas. Loss of skeletal mass occurs in this old age. Asthikhyaya occurs, Sandhigatavatta and Nidranasa. Nidranasa is very common problem during this old age. So what we are giving in our day-to-day practice, Gugulutiktaka Gruta Matravasti for the Asthigatavata, and Sansamana Sneha also we are giving. Sansamana Sneha we are giving same Gugulutiktaka Gruta gel capsules we are giving. Highly we are using Gugulutiktaka Gruta gel capsules and Khirabala 101, all those things we are giving. And Balyabasthi also is preferable in case of the Sandhi, just like Januvasti, Katibasti, all those things are advisable now in this age. And Sirodhara for the Nidranasa, Sirodhara is preferable. Sirodhara with Himasagara Taila. Sirodhara with Himasagara. If Himasagara is not available in more quantity, you can mix the Himasagara with Khirabala Taila and give the Sirodhara. And Abhyanga also. Then Sukrabhasrotas, Balahani occurs obviously. Then in those cases, Sarvanga Abhyanga and Matravasti is preferable. Then Purishabhasrotas, already I told, constipation as well as fecal incontinence. It is the very common problem in the old age. For the fetal incontinence, Gudapichu, it is one of the very good treatment. Along with internally, you can give the, for the to enhance the sphincter capacity, you can give the Khirabala 101 Khirabala capsule to have the control on the sphincter. Then Gudapichu is advisable and Matravasti is advisable with Sukumar Gruta. Matravasti is advisable during this age. Then comes to the Indriya Vikruti. Already I discussed that it's all sorts of the Indriya Nasa occurs in this. According to Ayurveda, also Sarangadhara mentions Savi Indriya Hrasa occurs. So during that time, Netra Tarpana, Netra Seka is for the cataract. Netra Seka is Triphala Kasaya Netra Seka is highly effective. You can try it very nicely. It is Netra Seka. It is working very nicely. Then Karna Purana with Khirabala Taila, Karna Purana with mainly we are trying it with the Khirabala Taila, and Gandusha. Gandusa is also to enhance the tastelessness, to enhance the lack of taste, lack of rasagyana. So during that time, Lavana Daka Gandusha, add little bit of Tankana, add a little bit of Irimedadi Taila, and administer the Gandusa. It is also highly effective. Then Mutrabha and Swedabhasrotas, incontinence of the urine, and here also it is better to go for the Matravasti for the Vayu Anulomana, which can reduces the incontinence of the urine, because it provides the strength to the all the Apanavayu. It will remove the Apanavayu Vikruti and it can be tried better, and followed by the Rasayana. Because in this Siva Gutika, like that things you can give in these conditions. Then comes few guidelines. So this is whatever the based on the age changes, based on the age, what are the physiological changes occurs in the life period, and based and what are the pathological conditions may occurs, and due to based on that pathological conditions, what are the panchakarma in day-to-day practice we are giving. I have already go through that everything. Then few guidelines based on my experience I want to share with you, because it is very difficult in the when we are either in your hospital or in your personal clinic to convince the patient for the panchakarma. It is a great job. So be confident on your science and convince the patients by aturasya antaratmana. Be friendly with the patients and try to convince the patients for the panchakarma, because so many diseases are there. It is very difficult to cure by administration of the simple Samsamana Ausadi. It is better to go for Sodhana followed by Samsamana. So convincing the patient is very more important task for the new generation. I am advising first you be try to your vocabulary, improve your vocabulary to convince the patient. It is the great job for the Panchakarma physician. Then proper advice during the Snehapana. Remember that's why the Shastra Jnana is also essential. So what is the Jiryamana Sneha Lakshana? What is the Sneha Jirna Lakshana? What is the Samyak Snigdha Lakshana? These things also everybody you should remember it. And during that time, because Snehapana, the Sodhana, the top period is Snehapana. The patient will 10 times they will call you, they will, and sometimes, for example, Snehapana, they will ask, my color of the urine is getting red. What I can do? So that is due to the only, if you are giving some medicines for the Sneha, suppose Tila Taila you are giving, obviously the patient's urine will be red color. So you should not get afraid. That's why you should be very strong before advising any sorts of the Panchakarma practically. So special care during the Panchakarma. That's why in our Shastra it is mentioned that Dandiga, Gopala Iva Dandiga. Gopala Iva Dandiga. Just Gopala strictly he mentioned by how he take care of, by means of the stick he take care of the couch. In the same way, we should take care of the patients, and how the oil, how during taking the oil we are very much conscious. Similarly, when you are advising the Panchakarma also, after giving, for example, I am giving one example, when you are giving the Niruha Basti and the patient never pass the Vega, don't leave the patient like that and go away. You have to wait till the patient passes. Particularly when you are giving the Niruha Basti, it is very much important, and don't keep the toilet closed. Don't advise them to keep the toilet closed. So it is also so many care you have to take during that period. So special care during the Panchakarma. During Vamana, be careful regarding the expulsion of the blood. So it is very much essential when we are sometimes in the Vamana Karma, from the starting the blood came. First Vega the blood came. So during that time, what? Don't get afraid. If it is blood come after 4, 5, 6 Vega, then you may think that it is Ati Yoga. From the starting, if the blood came. So before, that's why before advising the Panchakarma, you should take care the history properly, that whether he is a cardiac patient or what, any sorts of bleeding disorders is there or not. That history taking is very much important, and if possible, you can take the all sorts of the reports of ECG, everything you can conduct before. It is better, it is advisable. So if in our practice, one is starting Vega, the blood comes. But because he had taken the Snehapana properly and all, I went for the next Vega, second, third. But gradually that reduces. The bleeding reduces after the third Vega. Then we continue it, and it we become successful to finish the case. So, but if it is after 6, 7 Vega, if the blood comes, so you should take care of that, and you have to stop the Vamana Karma. Similarly, Virechana Ati Yoga, if it is 25, more than 30, more than 25 Vega, and it is not getting stopped, you should be take care of about that. So always keep the medicines with you when you are advising any Panchakarma therapy. Then Basti Pratyagama, already I have discussed that part. Basti Pratyagama, it is very much essential. Unless Pratyagamana Niruha, specifically Niruha Basti, you should not leave the patient as it is. You have to take care of the patient properly. Then Nasya Ati Yoga. In my practice life also, I have seen one Nasya Ati Yoga, which is very rare, but just like she went just like to get faint. So that is the Ati Yoga Lakshana of the that is Sodhana Nasya. So during that time, sprinkling of the cold water is very much essential. Then next stage, conclusion. Degeneration is unavoidable. Obviously, degeneration is unavoidable, but it can be prevented up to certain level by proper administration of the Shodhana or Panchakarma. Proper administration of the Panchakarma provide better life to mankind by its healing approach. So whatever I discuss, all those things, Panchakarma, my topic was Panchakarma an ideal healing procedure. So based on the age, definitely the care occurs. And I showed how the physiologically the care occurs, and which leads to what are the pathological conditions, and how the treatment we are giving. What is being the Ayurvedic physician? What is our aim? Dhatu samya kriya chukta tantrashasya prayojanam. So proper administration is to maintain the equilibrium of the dhatu. That's why Rutushodhana we are conducting for the maintenance of the health, to enhance the immunity. So to mankind, it heals, its healing approach through prevention. So proper administration of Panchakarma provide better life to mankind by its healing approach through prevention, promotion, rehabilitations, and cure. Utilization of dosa, bruddhi, and kya jnana is the need of the hour. That's why I'm telling, don't be so interested to name the disease. It is better to go to detail it through the dosa bruddhi lakshana and dosa kya lakshana. Our head of the department, when we are in the, your principals are also the student of the Dr. Naran Mishra. So excellent, great physician of the Odisha. So utilize, always he had given more importance to the dosa bruddhi and chaya lakshana. So utilization of dosa bruddhi lakshana and chaya lakshana, it is very much important during the time of the administration of medicaments, administration of any procedures. Then confidence, faith, skill, presence of mind, practical exposure, Shastra Jnana are the key points to flourish Panchakarma Vijnana as well as Ayurveda globally. Some of the Panchakarma conducted in our college, just I want to show you the pictures. Madanaphala Sanskara, we used to do the Madanaphala Sanskara in our college, and that Madanaphala Pippalichunna we used to use for the Vamanakarma. You can see the stepwise how our students, they used to do it, Madanaphala Sanskara, then till the Phala, and some of the Panchakarma procedures, you can see the picture. Then lastly, I want to conclude Sastram Jyoti Prakarsatha Dasanam Buddhi Atmanam Tabhyam Vishaksam Tabhyam Chikischa Paraditam Chikischite Trayapada Yasmat Vaidya Vipasrayam Tasmait Maitri Karunam Arti Susakya Priti Prakruti Seshu Bhutesu Vaidyam Bruti Chaturvidam. So, being the physician, being the Ayurvedic physician, it is very much important in our life. Definitely, success we will see, unsuccess we will see. But it is the duty of the physician is to read Sastram Jyoti, to read thoroughly. Then some Guna Sampat, we have to enhance our skill in the periodic manner, regularly. For example, to present this guest lecture, definitely I have to read little bit. So please enhance your Vaidya Sampati. Then only time to time. Then Maitri Arti Sukarunyam. When we are treating, we should take care of, we should think our patient just like our friend. Arti Sukarunyam, that is Vaidya Bruti. We have to be kind about during the, specifically for the Panchakarma specialist, it is very much important to Karunya Martesu, to be kind-hearted with the patient, Sakya Priti, to cure the, have interest for to cure the curable diseases, and Prakruti Stesu Bhutesu. If it is not curable, the patient is going to die, don't try to scratch money from him. Just you tell the conditions, explain the conditions, and allow them to go. So this is, with these few words, I am concluding my topic. Any queries? Hello? Hello?
Hello, ma'am. Thank you, ma'am. Thank you so much, ma'am. It was a very knowledgeable session, ma'am. Now I request Dr. Supriya, ma'am, for vote of thanks.
Good afternoon to all. Today on this 8th day of our webinar series Panchajanya 2020, We had very enlightening speak by Dr. Sanghamitra Patnaik ma'am. Ma'am has presented very effectively multiple aspects of her topic, an ideal Ayurveda healing process. She was very elaborate, has very elaboratively explained us about the Panchakarma in various avasthas, the physiological, pathological changes in different stages of the life. The most attractive point was the Dhatu-wise Shodhana, ma'am, which you were very elaborative today, very innovative, and it was very easily graspable points, ma'am. Thank you so much, ma'am. And the most important point you mentioned in the last few slides about how to take care of the Shodhita person was very innovative, ma'am. Thank you so much. We are very grateful and thankful to you, ma'am, on behalf of myself, my staff, and teaching faculties. Thank you so much, ma'am.
Thank you. Thank you.
Nextly, I would like to extend my thanks to our chairman, committee members of our institute, and our principal, sir, Dr. K.C. Das, for their continuous support in conducting this webinar. Thanks to my department staff, colleagues, and other college staff members. Lastly, to all the participants and delegates for patientful listening and making this session very harmonious. Thank you, one and all.
Thank you. Thank you very much.
Shall we end the session, ma'am?
Sure, sure. Why not?